My name is Addison Nance.
My name is Casey Rogers.
Today, our purpose of this presentation is to inform you about the critical topic of public health care within the U.S. This has been a demanding topic of many citizens throughout America, and it has been for over hundreds of years.
Constitutional basis. There is no explicit right to health care in the Constitution, but the closest thing is, in Article 36 of our Constitution states that all citizens are protected by the state in relation to health. This means that under the Constitution, every person that is legally recognized as a member of the country is ensured health care. Amendment 17 of our Constitution is also focused on health care as a right for all Americans.
Current state of the issue. The state of public health care is increasing throughout the United States. Over the last 5 years, access to public health care in the U.S. has increased at an annual rate of about 4.1%. But there are still shortages in providers regarding primary, dental, and mental health care.
The most crucial law regarding it. HIPAA and ACA are two of the most important healthcare laws. HIPAA protects the privacy and security of all healthcare patients, and ACA helps expand healthcare insurance coverage and costs. The ACA has reduced the uninsured rate and helped reshape healthcare policies.
The most critical executive action about it. In 2025, President Trump announced that he is going to start empowering patients with clear and accurate healthcare cost information. This is a big step in public healthcare because patients usually don't know what they're paying for. This will help average out and increase the positive view on public healthcare within the United States.
The most critical court ruling about it. In 2012, there was a court ruling called the National Federation of Independent Business versus Sebulus. This case, the Supreme Court held the ACA as an individual mandate tax, which confirms Congress's power to require health insurance from citizens. This ruling is very important because it kept the ACA intact.
The current public opinion of the issue. Regarding the public opinion, statistics show that about 70% of citizens support the public healthcare options. Many states have implemented their own public healthcare insurance options, which has been met with a lot of public support.
Success story from another nation in solving this issue. The United Kingdom's National Health Service is a huge success. The NHS is publicly funded health service that provided health care to citizens and residents of the UK. Polls showed that there is a huge public support for the principles and execution of the NHS in the United Kingdom. It provides access to hospitals, physicians, and event mental health care, and it plays a huge role in the United Kingdom's economy and overall well-being.
A failure from another nation about the issue. In Venezuela, public health care collapsed due to the falling of the economy and instability. Their healthcare is in crisis, struggling with medical shortages such as medicine, equipment, and supplies. This leaves them unable to treat patients with health conditions or quick sicknesses. This failure to provide public health has affected over 70% of their population.
A large public interest group that gives money and supports the issue, AFA. AFA is a large public interest group regarding public health care. It stands for American Public Health Association. They gather and fight for public health issues and policies, promoting equitable health and well-being. They influence federal health policies while using scientific-based statistics to help better the United States healthcare.
Large public interest group opposing. Americans for Prosperity is an organization that opposes support for public health care. It was founded by the Koch brothers, and they believe in supporting the American dream. They argue that government-run institutions lead to higher taxes, less access, and no individuality in personal health care.
How a conservative state has dealt with the issue. Conservative state. Recently, Arizona has been seeking an amendment to resist unlimited access. They want the requirements to be consistent with working requirements and a 5-year limit. They want to be able to ensure coverage for vulnerable populations or people that need it, rather than people who don't or take advantage of the system.
How a liberal state has dealt with the issue. California has taken steps to being a single-payer healthcare provider, which has been seen as the Healthy California Plan. The bill hasn't been passed yet, but it shows the state's involvement and commitment in taking steps to expand public healthcare access.
Proposed solution by a U.S. politician that has not taken effect. A proposed solution by a U.S. politician that has not taken effect is a single-payer system. Many states have started to take steps towards it, but it has not been implemented across the United States yet. A single-payer system would include the government collecting funding and paying for all healthcare costs.
Futures. Where do you foresee this issue in 5 years? In 5 years, we believe the idea of a single-payer system will be expanded across the United States. Political stances and resistance still may face issues and diverse opinions regarding the issue. The issue will still likely be a topic of conversation throughout states and the government for years to come.
Thank you for your time.